how AI is going to help doctors franchise. So this is Dr. Raval. Welcome to Doc Dynasty, committed to power, profit, and independence for physicians. So let's look at this system that we have currently. Why can't doctors scale? Number one, each office depends on the doctor who's there, how they practice, how fast they practice. Number two, there's overhead for the clinic. There's overhead with your staff, which prevents adding practices because each one costs more money, obviously. It also creates management problems, right? So if there are 3 practices going at one, each has its own staff. The staff has their personality, their personal problems, et cetera, et cetera. It makes it hard to manage multiple locations. And they are difficult, practices today are difficult to sell at decent valuations because each practice is so different than the next, even within the same profession or specialty. So let's look at something else. Let's look at a franchise like McDonald's. What makes McDonald's successful is that they've come up with a work plan where they can put anybody in and this person follows this workflow. It standardizes the system, the workplace, and the workflow. It also produces repeatable customer experiences because behind all that is lots of data from lots of locations. It creates training protocols for your front desk or for another physician that steps in. This is how things work. There's consistent outcomes, and it depends on a very strong brand identity. So we've talked about this a lot on this channel. Start your brand. Start with the same signage, same colors, and every phone call should mention that brand name. It's very important if you want to scale your practice or you want identity in your practice. Step 3, how will AI help doctors? So despite all the media out there, I've been in practice for 36 years. There's all kinds of stuff that's happened in 36 years. I think it's very hard to duplicate the doctor experience. So AI can only help that, but you have to be strategic in how you practice, whether it's for someone else or yourself. Everything a doctor does has to have data behind it, meaning it's collectible data. If someone says to me, what are the things that you treat? I can pull up all my diagnosis and treatment codes. This is what we treat. This is how we bill it. In the same way, you want AI generated assessment forms, the forms that patients fill out. You want AI generated patient education. Someone comes in with a certain diagnosis, we give them certain paperwork. It follows a certain protocol that we've, again, found to be successful. You can use your clinics while you're in training or while you're doing your fellowships to come up with that protocol. So this is strategic time that you can develop protocols that work. You want AI generated care plans. Based on the data that comes in, you can actually go onto ChatGPT and say, these are the 5 things that I treat the most. This is how I've been doing it. Create a care plan for me. And that's what every patient with that diagnosis follows. It allows quality control and it allows follow-up systems. In the end, your practice will be valued by the data that it collects and these automated systems. So that's what we're talking about all week. Follow on all our channels, including YouTube, for more on this broken down.